All right, well, hi everybody. Thanks so much for coming tonight. I know our lives are all crazy, so the fact that you're here tonight is awesome, and I appreciate you taking the time to come. And I'm curious, how many of you actually have heard about fertility awareness or have done it, or anybody? Cool. It's going to be a really interesting night then. Well, my name is Lisa, and tonight I'll be talking about menstrual cycle health. I'll be talking about fertility awareness and why our menstrual cycles are actually important. And I think when I bring up fertility awareness, most people kind of have heard about the rhythm method. I don't know, is that something that comes to mind when you hear fertility? Yeah. And so the rhythm method is kind of not even a method. It's something that they used to use back in, I don't know, 50s or the early 1900s. But basically it was relying on a woman's past cycles to guess when she'd be fertile next month. So the effectiveness rate of something like that is like 50%, like flipping a coin. And unfortunately, it's still lumped in with the fertility awareness method. And so that's often why people say that it's not effective. But the fertility awareness method is actually based on scientific research. And we'll talk about why it works. And when it's used accurately, if a woman is able to learn it correctly, it's about 99.4% effective. So there's a study on the effectiveness of it. So we'll get into that a little bit more, but that's just a little bit of background. So it's not the rhythm method, it's not something hokey, it's actually based on science. And a little bit about me, I've been charting my cycles using fertility awareness for probably about 13 years or so, since I was about 19. It's been a really long time. And I'm obviously pregnant, so clearly. So the thought occurred to me that I'm coming to you saying, oh yeah, it's really effective, and here I am pregnant. So some of you might be wondering, like, what is she talking about? But basically, since I've been using the fertility awareness so long, the amount of time that I actually used it to try to conceive, if I added up the months, it's probably only 6 months within that period of time. So the cool thing about the fertility awareness method is it actually allowed my husband and I to avoid pregnancy for the vast majority of the 8 years that we've been together. And then when we were ready to start a family, it's really easy just to kind of flip the switch and start trying to have unprotected sex during your fertile window. So it helped me to identify exactly when's go time. So that's just a little bit about that, so that none of you think, oh yeah, it's really effective, look at her. But I actually learned about the fertility awareness method when I was in university, and a little bit about my background is that I was just really fortunate. I went to university in Edmonton, and there was a group of women who would lead monthly fertility awareness. It's called the Fertility Awareness Charting Circle. But it was basically a group of women who taught. And so when I learned among women who taught and were also learning. And I went on to do training through Justisse HealthWorks, which is one of the very few organizations in North America that teach fertility awareness. And so I was fortunate to be able to actually learn to teach introduction and to teach how it works by someone who is a certified fertility awareness educator. So that's a little bit about my background. But obviously I don't live in Edmonton anymore. And when I moved out to Toronto, I wasn't sure how to incorporate this into my life because it was always something that I did kind of on the side. So recently I decided to start a blog and a podcast, and that's how I met Dr. Darou. And so that is my way of kind of getting back into this work. And part of the reason that I wanted to get back into this work is because now that I'm in my 30s, as many of you know, this is when everyone starts having babies. And I realized that I'm able to take all this knowledge for granted. I know how my menstrual cycle works. I know exactly when I'm fertile, exactly when I'm not. I've known it for years, and most women don't know that. And so I kind of feel it's almost my responsibility to share the knowledge that I have, because it's important. So by the end of the session, you won't have the ability to chart your cycles and know every single thing about fertility awareness. To give you an idea, a proper introductory session takes about 2.5 hours. So we're not going to be doing all of that, but I will be talking about, we'll be going back to biology class. So I will be talking a little bit about the hormonal cycle and all the things that are happening in the background. So it's a lot of information, and we'll have time for questions afterwards, I'm sure. And I wanted to start tonight with a quote. And the reason I chose this quote, so your body is a field of living information with feedback loops constantly in place. What's that about? So the reason I chose this quote is because the menstrual cycle is operating along with the hormonal cycle, along with the cervical mucus cycle, along with changes in the cervix, along with changes in the basal body temperature, and they're all connected. And so you'll notice as I talk about these things, they're all connected to one another. Nothing is happening in isolation. And it's also connected with our health and our overall functioning. So it's really neat stuff. And so one of the first concepts that I wanted to introduce to you tonight is the menstrual cycle as the fifth vital sign. And basically this gets into why menstruation is important, why a woman's menstrual cycle actually matters, even if she's not currently trying to get pregnant. Because often we know it matters when you're trying to get pregnant, but then in our culture it's kind of like if you're not trying to get pregnant, what does it matter? In September of 2004, advocates for a woman's sexual and reproductive health met at a scientific forum, and it was called The Menstrual Cycle is a Vital Sign. And the purpose of this meeting was to increase awareness about the role of the menstrual cycle as a unique indicator of a woman's overall physical health. And at the conference, so this quote is from a woman named Paula Hilliard, and she's a professor of obstetrics and gynecology at the University of Cincinnati. So what she says is that the menstrual cycle is a window into the general health and well-being of women, and not just a reproductive event. It can indicate the status of bone health, heart disease, and ovarian failure, as well as long-term fertility. So therefore, if a woman is not having her period, it is the first sign that something else could be going on. So what does this mean? And basically what it means is that a growing number of health professionals are starting to recognize the role that the menstrual cycle plays in overall health. And so if a woman's menstrual cycle isn't normal and healthy, hi. You can take one of these. You're welcome. Okay. But yeah, if a woman's menstrual cycle isn't healthy, it's an indication that there could be something else going on. So in the next slide that I have here, this is a quote from a woman named Jerry-Lynn Pryor, and she's a professor of endocrinology and metabolism at the University of BC. And she's also a board member for the Society of Menstrual Cycle Research. And so she goes on to say that we as a society are allowing the one vital sign that's unique to women to go unmonitored, which could ultimately lead to an enormous uncontrolled experiment with a woman's health, which is arguably what's happening now. Regular menstrual cycles with consistently normal ovulation, so before menopause, will prevent osteoporosis, breast cancer, and heart disease in women. So that's a pretty profound statement. It's a pretty strong statement for someone to say that menstruation will prevent those illnesses. So she's done a lot of research in this area, but basically the reason why she would say that is because of what's happening in the background of our menstrual cycles. So not to oversimplify her work, but this is a slide that just illustrates what's going on hormonally during menstruation. So this is the beginning of menstruation, and I'll pull this slide up a couple times. I'll refer to it a couple times tonight. But this is menstruation. So the first day of a woman's menstrual cycle is her menstruation. And then this kind of goes through until here would be the last day before her next menstruation. And this line here is ovulation. So in a healthy cycle, it typically happens close to the middle of the cycle. And as you can see in the beginning, the first half of the cycle is characterized by estrogen. So the first half of the cycle is basically what happens is our follicles, so in our ovaries, they're preparing for ovulation, as we all know. And that little follicle that's going to eventually release the egg, that's producing a ton of estrogen. And eventually the estrogen levels rise up high enough, and that triggers our body to ovulate. And the same little follicle then bursts, and the egg literally bursts out of it. And then in the second half of the cycle, that same follicle, now it's called the corpus luteum, so you could actually look at it if you could look inside and see the ovary. It starts producing progesterone. So when Jerry Lynn Pryor is making those statements about how important menstruation is for overall health, and a really important part of what she's saying is that when a woman isn't ovulating, her body isn't producing progesterone. And as you can see, after ovulation, there's a surge of progesterone. And what happens is both estrogen and progesterone are very important hormones. Estrogen has what's called kind of like a proliferating effect, so it promotes cell growth. So estrogen is important in growing the uterine lining, so it's kind of like the first stage. But progesterone also does some proliferation, but what it does is it actually helps the cells to mature. So progesterone has a counterbalancing effect. And what happens is if a woman has estrogen but not the progesterone to balance it out, that's actually a contributing factor in things like breast cancer. Progesterone plays a really important role in bone development. And surprisingly enough, it also plays an important role in heart health. So when a woman isn't ovulating regularly, she becomes at a higher risk for some of these things. So that's very simplified explanation of Jerry Lynn Pryor's work, but it kind of gets you thinking that, hey, maybe my menstrual cycle is important, and it does play a role in my overall health, not just my fertility. Okay, and that's like a huge picture of an ovary. So this is basically what I was talking about. So it takes you through what it looks like inside the ovary during the whole menstrual cycle. So this would be at the beginning of the cycle where the oocytes are really small, and they start developing as the follicle matures, and the whole time that follicle is producing estrogen. So obviously this is ovulation, where there's a literal burst. Some women actually feel it. It's called Mittelschmerz. Ever felt a pain in your abdomen? And then the follicle then turns into the corpus luteum, which then produces progesterone for the rest of the cycle. Okay. So I had mentioned that menstruation is considered by some medical health professionals as the fifth vital sign. And so what is a vital sign? Basically, a vital sign is a measurement that's used to determine normal and healthy functioning. And so this includes things like our body temperature, heart rate, blood pressure, and respiratory rate. Respiratory rate is just the number of times that we breathe each minute. And so since our whole body is interconnected, when one aspect of our health and vitality is off, it has an impact on the other aspects as well. And our menstrual cycle can be considered to be a vital sign because when certain health factors are off, it actually shows up in your menstrual cycle, which is really interesting. When you chart your menstrual cycles, you can actually see these things. So a few examples of what factors could impact your menstrual cycle. So endocrine system. So for example, if your thyroid, if you have hypothyroid or hyperthyroid and you chart your menstrual cycle, that can show up on your charts in a number of different ways. So first of all, charting, I didn't mention that when you're charting your cycles, you're charting 3 primary fertile signs. And so one of them is cervical mucus, which we'll talk about in more detail. One of them is your basal body temperature, so you basically take your temperature every morning. And then the other is cervical position, which some people consider to be optional. But because you're taking your waking, resting body temperature every morning, if you're hypothyroid, for example, some women actually can detect that they're hypothyroid just from that. So because your temperatures are then lower than they should be. Similarly with hyperthyroid. But it also shows up in different ways on your chart. So if a woman's hypothyroid, she tends to have maybe longer cycles outside of the normal range. So it can show up in different ways. Environmental factors. And so that includes things like xenoestrogens or endocrine disrupting chemicals. And so does everyone know what a xenoestrogen is? No? Okay. So a xenoestrogen is a big fancy word that basically means it's a chemical that impacts our body. So our body thinks that it's estrogen. So it's a chemical that has an estrogenic effect on our bodies. So an example of a xenoestrogen, like is hand lotion with perfume in it, or all of the different chemicals that we use all the time. So beauty products are notorious for it. So laundry detergent that's smelly, fabric softener, pesticides act as xenoestrogens, and other endocrine disrupting chemicals can include, if you're buying regular milk from the store and it has hormones in it and meat and all that kind of stuff. And basically what it means is that when we're exposed to these chemicals, so when we're putting on our lotion and we smell like strawberries, those chemicals actually act as estrogen in our bodies, and they can disrupt our menstrual cycle in different ways. And so when you're charting your cycles, you might notice, especially, for example, let's say, for example, a woman's charting her cycles and then she notices that maybe her cycles are kind of long or her cervical mucus production isn't what it should be. And then over time, she starts seeing Dr. Darou and starts eliminating some of these things from she starts eliminating the products with the chemicals, and she starts eating healthier, or whatever the case. She might notice her menstrual cycles actually become more robust and healthy. So it impacts us in surprising ways, and that's how it shows up in our menstrual cycle. So another example is physical and emotional stress. So I think most of us have kind of heard that when, say for example, an Olympic athlete, she's working out all the time and she gets her body mass index down to really low levels and she loses her period. So that's an example of how physical stress can impact our menstrual cycle, and emotional stress can impact it as well. Sleep disruptions. So it's interesting when women chart their cycles, maybe if you go on a vacation somewhere with a big time delay, you might notice that your ovulation is delayed because of the stress of that. And eating disorders, similarly to the body fat thing, it can impact your cycle as well. So a third factor are illnesses in the bodies, and this can include infections, allergies, autoimmune disorders, and cancers of the reproductive system. And what's interesting is that if you're checking your cervical mucus every day, say for example you have like a low-grade yeast infection, so you're not like super itchy and gross, but it's there. If you're you know what I mean. So if you're charting your cycles, you'll kind of know what cervical mucus pattern is supposed to look like. And so if you have this kind of consistent mucus every day, it might clue you in, maybe I have an infection, and it might, before it gets really bad, so you might know it in advance. I had a guest on my podcast, and her name is Colleen Flowers, and she's a fertility awareness educator. And she gave this really interesting example of how a woman was able to detect her cervical cancer really early. So this woman, again, charted her cycles, and she noticed that her cervical mucus pattern just wasn't what it normally is, her cervical mucus production. And so she went to her doctor. She didn't know it was cancer, but it turned out that they were able to diagnose her cervical cancer really early. And the type of cancer that she had is often very fatal because it's so subtle in the effects that it has until it's really bad. And so the doctors were kind of astounded that she was able to pick up on it. So it's just kind of different implications from charting that you wouldn't think at all. So another is diet and lifestyle. So nutrient deficiencies, exercise, sleep, drugs, vitamins, supplements. So I think again, if a woman is charting her cycles and she's trying to get pregnant and she's noticing maybe that she has suboptimal fertility, or she's noticing things that aren't where they should be, and then she starts making different changes to her diet, lifestyle, these are things where over time she might start to see real time how it's affecting her cycle in a positive way. So it's actually really cool. Since I've been charting for so long, my cycles have gone through different, obviously over a 13-year period, they're not going to be the same every month. And so when I incorporate different dietary things, it's interesting to see how it can actually improve the health of your menstrual cycle. So lastly, physical and structural issues. So this is just an example of how, like if you have endometriosis or ovarian cysts or uterine fibroids, because you're paying attention to what's happening to your cycle, if your menstruation is really heavy, or if you're noticing pain and it's consistent, or there's a pattern, by charting your cycles, these are things that your charts can help to indicate these things. Okay. And basically, as I mentioned, what it boils down to is that if our menstrual cycles aren't normal and healthy, it is an indication that there might be other things going on. And a lot of times when you hear about something like the fertility awareness method, it's really, you're hearing about it as a method of birth control, which it is, and it is effective, or to help you try to get pregnant, which it can. But the thing that you don't realize when you start charting your cycles is how much health information you can actually get from your charts. And so I'll just see, this is really counterintuitive, this thing. To kind of get into why the fertility awareness method works, I would say that one of the tragedies of our painfully inadequate approach to sex education is that we as women never really get the opportunity to learn what's going on, how our menstrual cycles work. It's kind of a mystery. And I'm guessing that most of you, if not all of you, could relate to my sex ed experience in junior high, where they basically pulled out the pads, and the purpose of that was just so that no one is hygienic for hygiene reasons. They don't want anyone bleeding in school, so they are like, okay, these are pads, clean yourself up, don't make a mess, this is how you change them. Yeah. And then the second part of it that I remember very vividly was that women are fertile all the time. So the sex ed basically in my school was like, you're fertile all the time, you can get pregnant any day, there are no safe days, and so therefore if you have sex that's unprotected, you will get pregnant. So by the nods I see I wasn't the only one. And yeah, they did show a diagram of the sperm and the egg and stuff, but they didn't really describe why we're fertile all the time, because we're actually not. And that's why fertility awareness actually works as birth control pill, or it works as birth control. And the way I see it is that the impact of those simple words that you're fertile all the time, it really sets the stage for a lot of the things that are really common, like the birth control pill. I think that if women knew that you're only fertile about 5 to 7 days each cycle, maybe some of us wouldn't be so willing to put ourselves on a contraceptive that's 24/7, because no one's having sex 24/7. I don't think. I know I sleep sometimes, especially now that I'm pregnant, so there you go. And yeah, I think it has a profound impact, because I remember having conversations with friends of mine who are in their 40s and have been on the pill all the time, and the thought of going off the pill is so scary, because again, you think, I'm gonna go off the pill on Tuesday and I'm gonna get pregnant on Wednesday. And it prevents us from being able to explore other options when it comes to birth control. Hormones don't work for everybody. Some people have negative experiences with them, but often we're afraid that that's the only option that's going to work. Okay, so why does the fertility awareness method work? So the fertility awareness method is based on a couple scientific principles, as I mentioned. One of them is this one. So a woman only ovulates once per cycle, and it happens on one day during one 12 to 24-hour period of time. So ovulation doesn't happen at random. It happens in response to the rising estrogens, so from the hormone slide that I probably have after this one as well. And obviously we know that a woman can release more than one egg during her menstrual cycle, but if that happens, it's going to happen within that same 12 to 24-hour period of time. And what happens if the egg is not fertilized is that within that 12 to 24-hour period of time, it disintegrates, it's gone, dies. And obviously, if that was the length of our fertile window, like 12 hours, it would be really hard to get pregnant, because that's insane. How could you schedule that? But in our body's infinite wisdom, our cervix produces cervical fluid, and cervical fluid is what allows sperm to live in the body for up to 5 days or so. And the cervical fluid nourishes the sperm, keeps it alive. It has an alkaline pH, sperm like that. Without cervical fluid, our vaginas are generally acidic to protect us from invaders like sperm or bacteria, those types of things. So without cervical mucus, what happens is, because the vagina is acidic, the sperm can't survive in there, so they die. So the majority of the cycle, our bodies are actually actively killing sperm. It's kind of cool. And so, yeah, it's pretty cool. And so cervical mucus is essential for getting pregnant. the old-fashioned birds and the bees way. I think I have the next slide here. So yeah, so that's just to show that's the same slide, so I'll just go past it. And so this is a little bit of anatomy. So this was the biology part I was telling you about. But basically this is the uterus. And this is a really neat diagram that just shows a cross-section of a woman. And the purpose of this is just to show that all of these different things run parallel. So this is our bladder, and that's parallel to our uterus here. That's the vagina, vulva. And then this is our anus, and they all kind of run parallel to each other. It's kind of neat. But this is the uterus, and this is the cervix. So the cervix is what dilates when you give birth. If you insert your finger into your vagina, you can usually hit something eventually, maybe. Not all women can feel it. Depending on what time of your cycle you're in, it's sometimes harder to actually feel, but that's where it is, what it is. So in this picture, that's the vagina. This is the cervix. And obviously these are the ovaries, fallopian tubes, and then I'll just go to the next slide, which is a really, really big picture of a cervix. And so basically, cervical mucus production responds to estrogen. So as I talked about the pre-ovulatory phase, so the first half, give or take, of your menstrual cycle, we saw the really high estrogen levels. And so estrogen actually stimulates the cervix to produce cervical mucus. And so cervical mucus production is in response to estrogen. And all of this is happening before we ovulate. So before we ovulate, when you're observing with the fertility awareness method, you can actually start to observe cervical mucus coming out of your vagina. So you observe it if you go to the washroom and you wipe from front to back and you look at the tissue. I don't know if any of you have ever had that experience where you kind of feel wet down there, slippery, and you're not in the middle of sexual activity. I know a friend of mine who I had on the podcast, she said that when she was in junior high, she would often run to the bathroom thinking she got her period, but really there was nothing there because it was cervical mucus, which she didn't know at the time, but that's what it was. And so the basis of the fertility awareness method is being able to identify when you're in your fertile window. So when a woman's in her fertile window, that's when she's producing cervical mucus. And that also means that the cervix is open. So during a woman's fertile window, estrogen also stimulates the cervix. In addition to producing cervical mucus, changes in the way the cervix feels. And so estrogen softens the cervix. And if you were to check your cervix every day, I know that sounds super exciting, but if you were to do that with the fertility awareness method, you'd notice a pattern. And so when you're outside of your fertile window, your cervix kind of feels hard, like the end of your nose. And when you're in the middle of your fertile window, your cervix often softens to the texture about your lips, and you can feel an indent. So the cervix actually opens during your fertile window, and the rest of the time it is closed. And in addition to the fact that it is closed, when you're outside of the window, your cervix, actually there's what's called gestational mucus that plugs your cervix. So your cervix is in a closed position, and it's plugged by this mucus that you don't observe. It doesn't come out, so you don't see it. But what that means is that the sperm actually physically can't get in when you're outside of your fertile window. This is what they would say, like the G-type mucus it's called, because who wants to say gestrogenic? But when you're outside of your fertile window, there's like 3 ways that your body's preventing you from getting pregnant. So the sperm physically can't get through the cervix. The cervix is actually closed because of that mucus plug. And then the cervix is also closed, as well as the acidity that I talked about earlier. So you actually, like I said, you need cervical mucus to get, in order for the sperm to live so that you can get pregnant. And as I mentioned as well, this all happens before you ovulate. So that's another picture of cervical mucus. Mucus is really cool, you know. It, in addition to feeding the sperm and keeping them alive, it also has channels to direct the sperm where to go. I know, it's really cool. And in this picture, I'll go back to this one. These are the cervical crypts. So just little channels in our cervix that are producing mucus. But what happens is, so you have unprotected sex during your fertile window, and you have lots of cervical mucus, and the sperm go up there. Your body kind of releases them a little bit. So that's because the 5-day window. So they kind of go in there, it's like a hotel, and then they kind of get released over the next couple days. And that facilitates them on their journey up the uterus. So the sperm have to swim all the way up here, and fertilization takes place in the tubes. So the way that Mother Nature arranges it is that you have the cervical mucus in response to the rising estrogen. Eventually that estrogen reaches the peak and triggers ovulation, and the sperm is here, hanging out, waiting before you ovulate. So you often hear women talk about, I have to find out what day I'm ovulating and try to have sex on that day. But technically that's not the best, most optimal time to have sex. The most optimal time to have sex is when you observe cervical mucus, so that the sperm are actually hanging out and ready to go when the egg drops. Because fertilization happens here, which is kind of cool. Okay, they didn't tell us that in junior high school, did they? Nope, they didn't tell you that there either. Okay. And so there is actually a point of your cycle, at least about 2/3 of your menstrual cycle in a healthy cycle, where you can have unprotected sex and not get pregnant. So the secret is out. And there's a lot more to it than that, but that gives you the basis. This is why it works. I'm just going to take a sip of my tea. I know the first time I heard, it was a long time ago, but the first time I learned this information, you could say mind blown. And I was also pissed off, because this is pretty basic stuff. We learned a lot about the ear and the eye and stuff in bio. Like, I don't know if you guys had that unit where it was like the eye took a month because of all the parts, and you couldn't have taken a bit of time to teach us about, because it's so important. Most women at some point, yeah, they would, but it's also so cool. But yeah, so this slide here is what's going to lead me into talking about what a healthy menstrual cycle looks like. Because one of the things that I want to do with the work I'm doing is really get out that idea that there is such a thing as a healthy menstrual cycle, and it is important regardless of whether you're trying to get pregnant or not. And most women have never been given the opportunity to learn what a healthy normal menstrual cycle looks like, what the parameters of healthy normal menstrual cycles are, so I'll be going through that. And obviously the current standard of care, I don't know if you've ever had the experience of, going to a doctor and maybe with some sort of menstrual complaint. So whether it's that you have painful periods, or maybe you're just wondering why your cycles aren't the same every month or whatever, and the doctor's response, go on the pill. The pill will regulate your cycles. So I'm going to take this opportunity to stand on my soapbox and talk a little bit about hormonal contraceptives. So I'm not going to go on about it because that could take all night. But I just want to make 3 kind of important points about hormonal contraceptives. So hormonal contraceptives are comprised of synthetic hormones by nature that are different to the hormones that our body produces. So even though it makes us all feel better that we call them estrogen and progesterone, they're not the same thing. So the synthetic estrogens and progestins in hormonal contraceptives are not the same thing. They're not bioidentical or whatever, and so they do different things in the body. The second point I want to make is that as for regulating menstruation, it doesn't do that. That's just a big myth. By definition and design, hormonal contraceptives are endocrine disrupting chemicals. So our menstrual cycles are functioning healthily when we can get pregnant, and by nature you take the hormonal contraceptive and it's disrupting that normal functioning. If it didn't do that, it wouldn't work. So that's why it was created that way. But that's how they prevent ovulation. So by flooding our bodies with the synthetic hormones, it suppresses our own natural hormones, thus preventing that estrogen surge, and that's what prevents us from actually ovulating. And then it prevents the endometrial changes and prevents the sperm from being able to implant, all that kind of stuff. I had a guest on my podcast. Her name is Dr. Laura Bryden. She recently wrote and released a book called The Period Repair Manual. Really good book. But she went as far as to say that hormonal contraceptives are a form of female castration. That's what she said. I was like, wow. But the reason that she said that is because when I show you the hormonal changes, the pill takes that away. So in a healthy cycle, you see the estrogen and the progesterone kind of ebbs and flows. But when you're on the pill, that all is just, the levels are extremely low. Which brings me to my third point. I'm guessing that most of us have been told that the pill mimics pregnancy, right? Like, oh, it makes your body think you're pregnant, so you don't get pregnant. Well, the pill suppresses a woman's natural hormone levels to that closer to a woman in menopause. Because during pregnancy, I wish I had but anyways, I'm gonna keep referring to the hormone chart. So in the hormone chart, or in the hormone diagram that I showed you, you saw that the progesterone levels were really high in the second half of the cycle. When a woman gets pregnant, those progesterone levels just keep on rising, and they stay high throughout the whole pregnancy. So I am loaded with progesterone and estrogen. So both of those hormones are at high levels, but as I mentioned, they're balancing each other out, right? And so when a woman is on the pill, she's not having those huge levels of natural progesterone and estrogen. Her natural levels are dried up, in the sense, very, very low, and that is why she's not ovulating. So that little piece of clarification, I think, is important because at least if women are choosing to use hormonal contraceptives, I believe that we should be informed. We should know exactly what the side effects are, and we should know exactly what it's doing to our bodies, as opposed to being told fairy tales like, it's like you're on the pill and it regulates your cycle, when it doesn't do that. Yeah, and so I'm stepping off my soapbox now about the pill. But I would just say that I feel that it's a symptom of how our bodies are viewed in our culture, because men are viewed as a standard. And so I think to some extent science doesn't know what to do with the menstrual cycle because it doesn't fit within the male model. And so instead of trying to understand it, we just kind of say, well, it's kind of irrelevant unless you're trying to get pregnant, without fully understanding that our healthy bodies as women include that. It comes with the package. It is not sold separately. So, officially off my soapbox. For real this time. Okay. So I'll talk a little bit about this slide now. So basically, this is a slide that shows cycle length variations. And as you can see, so this would be a short cycle, 21 to 26 days, moderate 27 to 35 days, long 36 to 60 days. This line again is ovulation. But what's interesting about this chart is that regardless of how long a woman's menstrual cycle is, the variation is happening in her pre-ovulatory phase. So generally speaking, when a woman charts her cycles, after she ovulates, the number of days from ovulation until her period is about the same every month in a healthy cycle. So again, 13 years of charting, it's usually about 12 days between when I ovulate and when I have my period. It's been that way for decades. And so it's really interesting when you start charting your cycles, because the concept of like your period being late is different, because when you actually know when you ovulated, maybe your period isn't late at all. Maybe ovulation was just delayed. So that's why I chose to start with that slide. Let's see what's next. Because now I'm going to talk about what the parameters of a healthy menstrual cycle are. And this is a big question, because menstrual cycle, as we've talked about, is much more than just the period. Obviously, there's a lot of things going on throughout the whole cycle. And as I had mentioned, the menstrual cycle begins with the first day of your menstrual period and it ends the day before your next one. So that's the full, so day one is the first day of your period. And so there are 6 factors that together comprise the normal parameters of the menstrual cycle. So I'll just go through them. And the first parameter is the cycle length, so how long is the cycle. And although we've all been told that our menstrual cycle should be 28 days, as if we're a robot, and any variation from that means that we're irregular, that's not actually true. So there is some variation that is normal and within healthy parameters. And if your cycle varies a few days each month, that doesn't necessarily mean that you have an irregular menstrual cycle. So the normal range for the entire length of the cycle is about 25 to 36 days, with an average of about 28 days. And regular cycles do have a bit of normal variation. So for example, if your cycles were 27 days one month, the next month it's 32 days, and then the month after that it's 28 days. That type of fluctuation is well within the normal range. Irregular cycles, though, are cycles that vary in length greater than about 10 days, and that variation is persistent over about 12 to 16 cycles. So perhaps over a year and a half, you have all these wonky cycles. So an example of that would be if one month your cycle is 21 days, the next month it's 42 days, and then maybe you go 3 months without a period, and that kind of thing persists, then that is truly irregular because that's falling outside of the parameters of normal. Oopsie. So I'll move on to, menstruation. So in reproductively healthy women, menstrual flow has kind of like a crescendo, decrescendo pattern. So kind of starting off moderate to heavy and then gradually kind of tapering off. So that's the typical healthy menstrual flow. The flow on average lasts about 5 days, but ranging between 4 and 7 days. And normal menstrual flow varies from 2 to 6 ounces, so 60 milliliters to 180 milliliters. Obviously hard to measure unless you're using a menstrual cup or something. But that at least gives you an idea. And menstrual blood consists of blood, endometrial tissue, and secretions. It should only have a minimal musky scent. It shouldn't smell foul if it's fresh. And the normal healthy moderate flow is normally about deep burgundy or red in color. And light flow tends to be bright red to pink or brownish. And as for pain, a normal healthy cycle, there's either no menstrual cramping or very mild menstrual cramping. So moderate to severe cramping is an indication that there's something wrong, and it is, although it's very common, it falls outside of the range of normal and healthy. And so this is important because, so for a woman, for example, who's learning the fertility awareness method, who maybe has been on the pill for 10 years, she hasn't actually had a menstrual period for 10 years. So the bleeding that a woman experiences when she's on the pill is actually called withdrawal bleeding. It's not the same thing as menstruation. So as we talked about, slide, yeah. So as we talked about in the beginning of the menstrual cycle, so this is the endometrial lining. And this is how it kind of grows throughout the cycle. So this is what that is a picture of. And then this is the follicular development. So that's like the ovary part again. So in the first half of the menstrual cycle, as we talked about, estrogen is a growth hormone. So it proliferates cells. So it promotes the endometrial lining to grow. And then after ovulation, progesterone has then another job. So it has a job of maturing the cells. And then when I was learning in Justisse, they would say that it makes the uterine lining secretory. But basically, as you can see, there's a lot more growth that happens and a lot more maturation in the second half of the cycle. So women who are on hormonal contraceptives, such as when they're having a bleed, depending on which type they're using, they'll often notice that their pill periods are really light and less cramping. So when I was a teenager, I was on the pill because I went to my doctor and I said, my periods hurt. And he was like, pill. I think he was writing the prescription before I finished talking. And so when I took the pill, my periods were super light and really easy to manage. But that's because the uterine lining isn't fully developing ever. And so that's part of the reason. So why I would spend time talking about what a typical healthy normal menstruation is so that you kind of get a sense that they're different, especially if a woman's just learning to chart, she needs to be able to become comfortable telling the difference between menstruation and maybe mid-cycle bleeding or something that is different to menstruation. Okay. Oopsie. So that brings us to the next part of the menstrual cycle. So we talked about menses. In a healthy menstrual cycle, see this green part here, what it means is dry days before ovulation. So those are days that you're not observing any cervical mucus. And in a healthy cycle, on average, a woman would have about 6 dry days before she starts to see cervical mucus, with the normal range being about 0 to 15 days. So that means that in the way that the cycle goes, you'd have menstruation, then some dry days, cervical mucus production here, and then after ovulation, the cervical mucus production would stop, and then you would have dry days until your period. And a dry day just means a day that you don't observe cervical mucus. And so one of the questions that women, I'm guessing some of you have, is can I get pregnant on my period? And so the answer to that is yes and no, because the first 3 days of true menstruation, your hormone levels are too low to trigger estrogen production or to trigger cervical mucus production. But it is possible, if a woman has a really short cycle, for her to begin producing mucus before her period is ended. So maybe on the very light days of her cycle, she could start producing cervical mucus, and because you're on your cycle, you probably wouldn't be able to observe it. So it is possible to get pregnant on your period. But in a healthy cycle, your cervical mucus production would generally start a few days after. And so the next stage, I'm like flipping around so much, but the next stage, the parameter would be cervical mucus production with ovulation. So in a healthy cycle, a woman would have about 4 days on average of cervical mucus. So 4 days with the normal range being between 3 to 6 days. So this begins with subtle changes. So at first you might observe cervical mucus that looks kind of like lotion. And then as your estrogen levels rise and your mucus production increases, you would eventually start to see egg white mucus, which is, they call it egg white because you can actually stretch it between your fingers. And it's lubricative, so it's slippery. So if you're, again, the way that you observe it, you would take a piece of tissue, and when you're going to the bathroom, before you go, you wipe and you look, pick it up if there's anything there, and you would feel it. So on days where you have that, it's called peak cervical mucus when it's slippery and clear, and so you can actually hit the back of the toilet with your elbow. And so this is important because a healthy woman would expect to see at least 1 day of cervical mucus with peak qualities. So there's different types of mucus, as I alluded to. So there's the lotiony stuff that isn't as stretchy, and then there's the peak type mucus that you can stretch. Some women have such a high water content in their cervical fluid that they can't actually pick it up, but it's just wet and slippery. Also, all of those things are fertile. So there's no such thing as like sort of fertile or not, like you're either in your fertile window or you're not. But when you're trying to get pregnant, it's optimal to try to have sex on days where you see cervical mucus with those peak qualities. So you can still get pregnant on days that you observe the lotiony stuff as well. But if you're trying to optimize your chances of getting pregnant, you're wanting to look for those slippery days. Pretty convenient, if you ask me. It's slippery, wet, all lubricative. Just saying. Okay, so then ovulation. So in a healthy cycle, obviously a woman would ovulate. And we talked about that, how it's triggered by rising estrogen levels. An interesting thing about the fertility awareness method as well is that, so when a woman's observing her cervical mucus, I talked about the slippery stuff. So the last day that she observes that slippery mucus, egg white, clear, all that stuff, the last day that she observes it is called her peak day. So you wouldn't know on that day that this is the last day that you're observing it. You'd know the next day when you don't see it anymore. But 75% of the time, ovulation either happens on that day or within a day, plus or minus. And 90% of the time, it happens either on that day again, peak day, or 2 days after. So basically, because everything is happening, back to that Deepak Chopra quote, because everything is happening in cyclical nature, it's all happening together, and so it's all working together. And so a lot of women are focusing on ovulation predictor kits and when am I ovulating, trying to figure out exactly when this is what they should be focusing on if they're trying to get pregnant. When do I see the cervical mucus? Because it is correlated with ovulation. And lastly, the post-ovulatory phase, or the luteal phase. So this is the period of time after ovulation. In a healthy cycle, menstruation would occur about 12 to 14 days after ovulation. The average is about 13 days, and it can range from 9 to 17 days. So the reason that this is important, as some of you may know, is that if a woman's luteal phase or post-ovulatory phase isn't long enough, then it prevents the egg from being able to implant.
You said 9 to 17 days?
That would be the range, but the healthy would be like 12 to 14. So I'm going to go back to this slide for a second when I talk about this, because after ovulation, the egg has a little bit of a journey to make. So as I mentioned, the egg is fertilized in the fallopian tubes, and then what happens is it kind of starts to reproduce. So the whole blastocyst thing where it's reproducing and multiplying and all that kind of stuff. But it takes about 10 to 12 days for it to come down here and be ready to implant. So what happens is that if a woman's luteal phase is only 8 days, then by the time that it's ready to implant in the uterine lining, it's already starting to fall. So the egg is just trying to implant and everything's falling down. And so that's really important, especially for women who are trying to get pregnant. And if you're not charting your menstrual cycles, you wouldn't necessarily know how long your luteal phase is. And so you wouldn't necessarily know that that is the problem.
When that gets shorter, is that like as you get older, is that the phase that gets shorter?
It can, but there's things that you can do to improve the health of your menstrual cycle and to increase the length. So it doesn't necessarily, it can go with the other, but it doesn't, it's like correlation versus causation. So it can shorten as you get older, but it doesn't necessarily mean that it's shortening because you're getting older. So there's lots of different factors. But the one thing, at least with the menstrual cycle charting, because the thing is that technically you could be getting pregnant every month, but if your luteal phase isn't long enough, your egg isn't implanting. It doesn't have a chance. It doesn't even have a shot. And if you can identify that, then when you come to your doctor, naturopathic doctor, you can actually work towards improving the health of your menstrual cycle and actually addressing that so that you can resolve it. And that can improve your chances of actually conceiving. So there's so many different implications that you wouldn't think of for the fertility awareness charting. And so to summarize all of that, for a woman who's struggling with fertility challenges, she can gather a lot of information from her chart. If she's not observing any cervical mucus, that in and of itself can show her, okay, I have suboptimal fertility. Maybe this is why I'm having trouble conceiving. So it at least kind of gives you a roadmap. It gives you something to work with, and it helps you to understand. And also, I'll put out there as well that if you're charting your cycles, and say you had a miscarriage really early along, so maybe you had a miscarriage, but it was in like, before you really know you're pregnant, I guess you could say. If you're charting your cycles, when you're taking your temperature, I mentioned that menstruation typically happens about 12 to 14 days after ovulation. So if you're charting your cycles and you're taking your temperature and you have 18 high temperatures, so basically 18 days from when you ovulated, you know that you're pregnant. So that's actually a positive pregnancy test if you have 18 high temperatures. And if you were to have a miscarriage, or if you were to get your period like 20 days after you ovulated, you would know that you had a miscarriage. Whereas if you weren't charting, you might not know that you had a miscarriage. You might just think it was a heavy period or something. So lots of implications there. So to finish up today, I'm just going to talk a little bit about the fertility awareness method and just to kind of sum up everything, and then we'll have time for questions. Hope I didn't go too much over. No, I didn't do too badly. Okay, so this is basically, as we talked about, or as I talked about, the fertility awareness method involves tracking those 3 fertile signs that I mentioned. So that's cervical mucus, basal body temperature, and then cervical position. Because the presence of cervical mucus indicates that you're fertile, it is the primary sign. And then the cervical or the cervical position checks are, like I mentioned, kind of considered optional. So it's good to know, if you're using this method and you're learning it, it's good to know what it feels like at different stages, but it's not necessarily something you have to check every day. But it can definitely help if, say, your temperatures aren't making sense, or they're not lining up with your mucus, or you had a night that you didn't sleep or something. It can help you to triangulate what's happening. And as I alluded to as well, when you're using the fertility awareness method, involves checking your mucus, taking your temperature. So what is a typical day like in the day of a fertility awareness user? Because often when I talk about these things, it would be like, oh my God, that's so much work, who has time for all this? So what does this actually look like? So basically, in a typical day of a fertility awareness user, like myself, I'm not really doing it now, but the rest of the time, when you wake up in the morning, the first thing you do before you get out of bed is take your temperature. So you basically put the thermometer in. It's a good practice to let it sit there for 5-10 minutes so that it warms up, so you can hit snooze. And then you take your temperature and you record it. So you can record it on a paper chart, which is 13 years ago when I started charting, but now there's all these cool apps. So the Darou app is really cool. There's Groove app. And actually with Darou, they've created this really cool thermometer called Wink, where you can take your temperature and then it like Bluetooths it to your iPhone. So you don't even have to write it down. Yes, welcome technological era. So cool. Okay, so that's the first thing you do, and then you stumble to the bathroom, and before you pee or whatever, or take a shower, you take a scientific instrument, toilet paper, and you wipe. And so you wipe your vulva front to back, and then you go pee. So it's really like, no one has to tell you, you don't really think about brushing your teeth at the end of the day, you just brush your teeth. So after you get into the habit of it, you sit down before you go to the bathroom, you just wipe and look. So it sounds like it's a lot of work, but you get used to it. So if you're using the Justisse method, which is how I was trained, you check every time you go to the bathroom. And then at the end of the day, it sounds like a lot, right? And you check before and after. And the reason you check after is because if you remember that picture of like the parallel, so your anus and your urethra and your vagina, it's possible that you could check and then have a bowel movement, for example, and then it pushes out cervical fluid that you wouldn't, I know it's kind of gross, but I'm just being honest. But it could push it out, and so if you don't check after, you could miss it, and you could think, maybe I'm not fertile that day, but there's actually cervical mucus present. So all of those details are things that I will not be talking about tonight, because obviously there's a lot more to it. But basically, throughout the day, you're checking for cervical mucus, and at the end of the day, you're recording what you saw. And so at the end of the day, if you saw mucus, you would record in your app or your paper whatever you saw.
So every day, every day, not just when you think you are producing more mucus,
Well, there's 2 answers to that question. So when you're first learning, you have to grasp it. And so you do want to check every day. After you've become quite comfortable with it, after you've confidently, clearly identified ovulation, you don't necessarily have to check after that, because you know after ovulation, a series of hormonal events prevent further ovulation. Progesterone shuts down cervical mucus production. It dries you up. Progesterone stimulates the changes to the cervix to make it firm again. And so you notice that your signs line up. Your temperature has risen, which we'll talk about next. Your cervical mucus has dried up. Your cervical position has changed. You'll see all these things on your chart. And so after that, you don't necessarily have to continue to check your mucus every day, but it's one of those things where you do And if your cycle isn't healthy, if a woman has a really long cycle and she has mucus, because sometimes if you're coming off the pill especially, your cycles can be different to the normal healthy cycles that we've talked about tonight. And so there can be a lot of checking. But again, no one has to tell you to wipe after you pee. So it's kind of like that. Okay. And so then at the end of the day, you just record what you saw. So all in all, even though it sounds like a lot when I'm talking about it, it's maybe an extra 4 or 5 minutes to your life once you get the hang of it. Okay, so I think so this chart kind of sums it up. So I talked about cervical mucus a lot, so I'll just talk about basal body temperature and cervical. Well, I don't know if I need to talk about cervical position, but basically basal body temperature is a measure of our resting basal metabolic rate. And the really cool thing is that in the first half of the cycle, with estrogen, after we ovulate, the surge of progesterone is what triggers that change to our basal metabolic rate. So I don't know, I'm like a science geek, so I think it's the coolest thing ever because it actually changes. Progesterone actually raises our body temperature in a measurable way. And so when you're taking your temperatures in the first half of your cycle, you'll notice that they're not the same every day, but they kind of range. And then after you ovulate, they range again. And you can draw a line, which is called the cover line, between your pre and post-ovulatory temperatures. And after ovulation, your temperatures stay above the line. And then if you get pregnant, they stay up. Some women actually notice a third shift. So it's kind of like, you know how hens sit on the eggs to keep the little chicks warm? So our bodies get a little warmer to keep the eggs warm. It's really cool stuff. And so the thing about basal body temperature is that it doesn't have any predictive value. There's no point in today's talk that I've said anything about, and you'll be able to predict when you ovulate, because you won't. The purpose of this method, that's why it works, and that's why the rhythm method doesn't work. It's because you're not actually predicting, but every day you're observing what you see, and you're making a decision. Am I fertile today or not? And that's why it works. And when you take your temperature, the temperature rising, the fact that your temperature went up, it means that ovulation took place perhaps the day before. So you're not getting this real time like, oh, I'm ovulating now. I swear I remember it was like Young and the Restless, and the woman was like at her desk taking her temperature, and she called her husband, and she's like, my temperature went up. I swear to God, I remember this. Yeah.
So that means it's your time.
Yeah.
When you're
Yes. Yes, exactly. So if you were taking your temperature and you see it go up and you're like, honey, let's have sex, you're missing the boat. Because, yeah, it's all about the mucus. Mucus is an amazing thing. Or fluid. Some people like to say fluid. I like to say fluid too, but I'm so used to saying mucus, it doesn't gross me out anymore. But that's a really important point to make. But even though it doesn't predict anything, it's still a really important measure because it does tell you that you have ovulated. So you can confirm after, there's rules, all these different rules, but 3 high temperatures over the cover line confirms that you've ovulated. And that's helpful, especially if your cycles are a little bit outside of the normal range, because otherwise you wouldn't necessarily know. The other cool thing about it is that even though you can't predict ovulation, you can predict your period. So as I mentioned, the post-ovulatory phase is about the same after you start charting every cycle. And so you don't have to be surprised anymore when your period comes because you can know to the day pretty much when it's going to come. So that is a super cool thing about the basal body temperature.
Your temperature will drop again when your period's
Yeah, the temperatures during your period tend to be kind of wonky.
okay.
But yeah, it does fall after. So if your temperature isn't falling, go buy a pregnancy test.
Question, how important is it that you're doing it like 7 o'clock or 7:30 every day, like getting your temperature every day at the same time? Can it vary within the hour and a half an hour?
See,
Or it needs to be at the same time?
well, from my experience, I would say that it's more important for you to make note of differences. Again, when you're first charting at the beginning, it's really good to get a baseline. So when you first start this method, it's good to kind of do it as close to the same time as possible so that you have a baseline. What I've noticed with my temperatures, because I don't get up at the same time every day, so I am not that person that is waking up at 6 with the thing and going back to bed, like, no, who's time for that? But what I've noticed with my temperatures is that if I sleep in, because what happens is your temperature kind of creeps up with every half hour of sleep. So if I sleep in, my temperature tends to be a little higher. If I get up really early, my temperature tends to be a little lower. So if most days if you get up for work about the same time, that's fine. If you're within an hour or two, it's not that big of a deal. But if it's a really big difference, make a note of it.
That might be why it does more fluctuation.
Yeah. And there's a couple different reasons. If your chart is absolutely not making sense, or if you have like 7 days of the same temperature, you gotta try to leave in the thermometer longer, because that makes a difference. And if you have like an old school thermometer, the shakedown, you gotta shake it down. You gotta leave it in for a long time. But to answer your question, your life does not have to be perfect to do the fertility awareness method. And if you have a couple days, and the other thing is that randomly sometimes you just get these random temperatures. Like, what if you have a fever or something? So randomly, you might get like a random temperature that's like way out of the range. And you just use the rule of thumb, which is literally, just put the thumb over it and then look at the overall pattern. So the answer to your question, in my opinion, would be, do your best. But if you have a couple days that are outside, big time difference, make a note of it. Because afterwards, when you have your chart, you can look back and that'll help you to figure out what was happening.
Do those apps chart? Can you look on someone show?
Yeah.
Like a whole chart?
Yeah, I'll see if I can open mine and I'll show you. When I started charting, there were not as many cool apps. One thing I'll say about apps is that because I do this, because I teach it, most of the apps will put you on like a predictor setting where it'll tell you when you're ovulating, it'll tell you when you're fertile and all that kind of stuff. And that's the rhythm method, because what it's doing is it's calculating what happened in your previous however many cycles and taking an average. And so although people are always like, the rhythm method doesn't work, people are also saying, my app tells me I'm fertile today. And so it's like, that's the same thing. So for me, my comfort level, and especially because I learned old school, I learned on a paper chart, like I made this Excel spreadsheet. And so I didn't have any app telling me anything. And so I was able to actually learn the fertility awareness method, like, okay, am I fertile today or not? Regardless of what happened last month, regardless of the fact that I ovulated on day 19 last month. It doesn't really matter, because if you do that, you'll get pregnant if you're trying to use it as birth control, and then you'll blame the method and say, it's the method. So for me, I don't use the predictor stuff because it's not useful to me. Because I'm serious about it. Because when my husband and I, for example, are preventing pregnancy, we're like not open to it. Like, I mean, we're open to it, but like, you know what I'm trying to say. Like with this baby, for example, we specifically started trying in a specific month, like before that. So I know a lot of women, everyone's different. Pregnancy is a really complicated thing. Sometimes you might be on the fence about whether or not you want to get pregnant, and so you're kind of less careful with your chosen method of birth control. It's a thing. It happens. Other women are like me, militant. But it depends, right? So yeah. But I guess I could stop it there, and because I think that's the overview I wanted to give today. And if you're interested in learning more about the fertility awareness method, there's lots of really awesome resources. There's a book by a woman named Toni Weschler called Taking Charge of Your Fertility. She just released her 20-year anniversary. There's another really great book by a woman named Katie Singer, and it's called The Garden of Fertility. And lovely note to end on. So fertility depends on a healthy body. Oh, The Garden of Fertility by Katie Singer. And Taking Charge of Your Fertility by Toni Weschler. Toni is Toni. and Weschler. Well, put it in Google. I think it's Weschler. But yeah, fertility depends on a healthy body, healthy ovum, healthy mucus, and healthy sperm. Seems pretty basic, but if all of those things aren't happening, fertility is not. And I did a really interesting podcast with an acupuncturist. His name is Dr. Mark Sklar, and we were talking about male factor in fertility. And one of the statistics that he used is that 40% of the time, it's actually not an issue with the woman. And so as women, of course, because we do all the heavy lifting, we tend to believe that it's always our fault if there's something going on. And a really important point that he made is that if you are struggling with infertility issues, that get the man tested. He just has to ejaculate into a cup, and then they analyze the sperm to see what's happening, because in a significant amount of the time, it could be something with his fertility. So interesting point to make. So yeah, that's it. And that's me. So if you want to check out my website or listen into the podcast, if anything that I talked about tonight was interesting to you, I've released 31 podcast episodes so far, interviewing some really interesting people all about fertility awareness and fertility and health and preconception, pregnancy care. I did a podcast with Dr. Darou, which is how I met Dr. Well, I think I met her for a second, but we virtually met before tonight. But so that's what I'm doing, and I'm actually working towards getting my official certification as a fertility awareness educator, because I love this work, and as I said before, I see so many women struggling with infertility, and this doesn't cure everything, obviously. Like, there's certain things where if you have 2 blocked fallopian tubes, like fertility awareness is going to give you limited assistance with that. But there's a lot of things that it can help with. I just keep referring to my podcast guests because they're so inspiring, but I interviewed a woman named Dr. Carrie Hampton, and she talked about how she's helped a number of clients who were referred to IVF clinics. And just by identifying their fertile window and timing sex specifically on that day, a lot of women get pregnant just by that. Obviously, it's not going to help in every case, right? And obviously, some women need to have additional help to improve the health of their menstrual cycles, but it's pretty profound, because I always give the example of if your partner was like out of town or something, or worked out of town, and kind of having that schedule of like gone for a week, back for 2 or whatever, you could totally miss your window every month and think there's something wrong with you. But there's not. You just need to know when you're fertile so that you need to be home this week, right? So, anyways. Welcome.